Hello and welcome to the pod. I'm Nathan Fink.
I'm Jasmine Torres Allen, and this is New Hampshire Family Now,
a show about building family in the Granite State. Today in the show, Jasmine and I discuss childcare, and we talk to parents, providers, advocates, and experts from across the field. New Hampshire Family Now is brought to you by the New Hampshire Charitable Foundation. Since 1962, the Charitable Foundation has worked hand in hand with generous and visionary citizens to maximize the power of giving and support, collaborate, and lead innovative initiatives. Initiatives like New Hampshire Tomorrow, which is focused on making sure children and families have access to education, healthcare, and career pathways to ensure every family member thrives. To learn more about New Hampshire Charitable Foundation and all their initiatives, go to www.nhcf.org. This podcast was also brought to you by Family Support New Hampshire. Family Support New Hampshire is NH's coalition of family resource centers and family strengthening programs that exist to ensure Granite State families have access to resources so both caregivers and children can succeed, because supported families are strong families. To find a family resource center near you, visit www.fsnh.org. Hello and welcome to the podcast. I'm Nathan Fink.
And I'm Jasmine.
We have a great show today, including a look at the state of childcare in New Hampshire. But first, we're recording live in Plymouth, New Hampshire. Jasmine, what are we doing here?
I am here for our hometown Plymouth.
I was wondering, because you had said, I'm going to be up here. Let's meet up here.
Yeah.
So tell me about my hometown Plymouth.
So our hometown Plymouth is a show that's a 30-minute segment that we go and visit all 221 towns here in New Hampshire. And we get stories from people who live here, who work here, who play here, and kind of learn more about each town.
Yeah.
And so it's really fun. So today we're going to be with Rebecca Rule and Skylar Scribner, the director, and we're going to be answering some questions and essentially signing people up for the segment and to film. And we're really excited because some of the stories that come out of these small towns are just, you just never expect it.
No, you don't.
Yeah.
New Hampshire has this thing where, yes, it's a state, but it's like got these really rich pockets.
Oh, absolutely. Of culture, of history, and even, the people who currently live here. Like it's amazing to pull back the layers on these smaller towns.
Yeah. Well, when I did ask you, we've been trying to get on each other's schedules for a while.
I know. It's been intense. It's been a little crazy. You've been momming it hard.
You have been. Yeah. And we've been a scramble. So I guess I want to talk about you because I think we're in the same boat. If you had to name your top two stressors at the moment, what would they be?
Definitely childcare is number one. Quality childcare, I should say, is number one. And the second part is balancing community with family life.
Yeah.
But the number one I have is childcare, because with my son, with his background in foster care and, now we're in kinship adoption, it's been a real big adjustment for him coming to New Hampshire and getting, acclimated to a new family and new space. And, he's had a really challenging time regulating his emotions. And unfortunately, and I'm not afraid to share this because sometimes parents are so embarrassed to say it. And I just want to normalize it, is he's been removed from 2 different preschools and due to his, behavioral issues. And so it's one of those things that's super hard to swallow because, you think you've got parenting down or you think you've got that gentle aspect. And sometimes, it's just how your kid is and their personality, and they're going through things. And as much as you try to be that gentle, loving parent and love them through these phases, it's moments like these that sometimes you're super embarrassed because you're how is this happening to me? Why is this happening? And I had to think about it as this isn't happening to me. This is happening to him. And so with his background being removed from 2 different schools, it just re-triggers every time that fresh wound. And so I spent a lot of time mourning that for him because he's a kid. He's not going to realize that, people don't want him in that space. The thing is, he's not going to vocalize it. He's going to act out in ways that, grab people's attention because he's been so used to being removed from that space that he knows what to do in order to get removed from that space. And so it's tough. And I was like really struggling, and I had to take a step back from work sometimes because I had to stay home with him and figure out childcare and juggling all of that. Plus, still being in community, still being, still having to participate in work functions and things like that. And also know that, things were falling apart at home, and, his behavior affected my daughter's behavior. And so it was just like, I couldn't find a middle ground or a space to breathe.
Right.
And at the end of the day, like my husband and I, we were just like check in with each other, like, how are you doing? Like, are you okay? And we would try to like love each other hard enough. Like, we know that this is just a time in our lives with our kids and that they will grow and they'll know that we love them. But in this moment, like, it was just him and I.
Yeah.
And, it was difficult because we didn't have many people to talk to, and talking about it made me feel super embarrassed because most people know me as like kind Jasmine, gentle Jasmine. And then they see my kids and they're like popcorning all over the room.
Yeah.
So like sometimes I have to remind people, I'm like, my kids are completely separate from who I am as a person. They are their own personalities and they make decisions, and I have to teach them about their decisions. Right. And him and I, we were leaning on each other so hard because we just felt so alone, and finding quality childcare for Jackson, it's not there. There's no childcare right now that can provide him the services that he needs in the state. And so, right now he has a babysitter. And right. So he gets that one-on-one time, which is fantastic. But now we've had to remove him from these schools, and he doesn't get to be kindergarten ready like everybody else, right. So it's one of those things where like you grieve those parts because you're like, I don't want him to miss out.
Yeah.
Even normalizing like going to the pediatrician to address behavioral issues. Like sometimes people are like, what? You have to do that? Yeah. It's really difficult to talk about because parents get embarrassed. They're like, I can't believe I have to do this, but sometimes you have to make those really tough decisions to be like, I need to go see my pediatrician, or I need to see a therapist. And right. And coming to that awareness, sometimes it takes like hitting rock bottom, which was when he got removed from his second school. And that was like rock bottom because we were at the height of his behavioral issues, but at the same time, he was being removed from his space that he really loved. And it was just then having to explain it to him is like really difficult.
I keep thinking about that because the thing with childcare is you don't realize how important it is until it's gone.
And how much it affects your daily life.
Right. So I was curious about that. So when you look at what childcare gave you, what would you say?
The freedom to be able to work without the stress of knowing that he wasn't in a good place. So like him being in childcare allows me to work and be able to provide for my family and, essentially be in community when I need to. Mm-hmm. But without childcare, I had to work from home more. I had to remove myself from community functions. There were a lot of things I had to stop doing, and even scheduling the podcast, you know what I mean? Like getting I was like, well, there's just too much going on. Then you realize like how many parents that happens to, that how many things they can't participate in, how many parents can't go and get a full-time job. They have to get a part-time job because there isn't a child care that provides full-time care. Sometimes it's only part-time
right.
care.
Me and my wife both work, so we need somebody to watch our son when we're working. I'm a firefighter, so I have a kind of an odd schedule. We need some place that can watch our son and help raise him.
I don't have the village that a lot of people talk about that you need. So it's basically just him and I.
Childcare is important to me because I work and I don't have a lot of families that would help me out with my daughter.
Yeah, right now I'm driving a truck and I really wish we could have childcare. We just cannot afford it.
You have your kids when you have them, which your experience then is frozen in the context of that time period. And it's hard for me to know what it was like for my parents with us because that was their context, right? So I don't know any better other than it's hard to find and it's incredibly expensive.
It's so expensive. Even the childcare places that we were looking at, charging $350 a week, which totally valid to charge, but I personally don't know anybody in my parent circle that can afford $300 to $350 a week on childcare. And so, that for a lot of parents, that's half of their more than half of their paycheck. Right. And it doesn't make it worth it to spend that money for an entire week of childcare. I'd rather pull back and work part-time and meet that schedule and be able to afford those pieces versus trying to afford an entire week.
Yeah. So you're at a decision point where you're either choosing social isolation or you're choosing to overwork, miss out on that child. So to pay for something that might not even fit your family's unique needs.
Exactly. Which is exactly what we would run into, is that even if we found a child care space that, could take us and we could afford, doesn't necessarily mean that they could meet the needs of my son. So it was just one of those tough things where, it's not that it's niche. It's just that there isn't enough of.
Yeah. And, Business New Hampshire magazine just did a great article on the state of childcare in New Hampshire and called it the childcare crisis. And I suppose for me, the question is, how did we get here?
Nicole Heller, New Hampshire Fiscal Policy Institute. That's a great question. And there are two areas that I want to address, and those are availability and affordability. If you take all of the children in New Hampshire whose parents are in the workforce, or they have one parent and that parent is in the workforce, and you subtract from that number all of the capacity for childcare spots, the state is short between 7,500 and 8,000 childcare slots. Now, that's a rough estimate. Not every parent wants their child to go into childcare, and not every provider's at full capacity right now due to staffing challenges. If you need a slot for a baby, you're going to be waiting a long time, because that's one of the biggest crunches right now. So just the childcare not available. And this can be particularly acute up in the North Country and more rural areas where there just aren't huge childcare centers in that area. And so families may be relying on family care providers, in which the provider has people come into their home and they serve a smaller number of children. But if those folks aren't able to make ends meet or meet their profits or even just break even, they may have to shutter. And that did happen during the pandemic. Between 2021 and 2022, the number of licensed providers in New Hampshire fell by 5%. So that made it even harder to find a slot for some families, depending on where you are in the state.
Jackie Cowell, Early Learning, New Hampshire. The pandemic really brought it to the front. So right now on the ground, it is still very difficult for the providers. About 30% of them have at least one classroom closed, not because there's no families. It's because they can't find the staffing. Mm-hmm. I actually worked in childcare as well as being an advocate now. For many years, once in Henniker, once in Portsmouth, and there was always a little bit of staffing problems here and there, but you could always end up finding a qualified, good person. You can't do that now. And here's the difference. Childcare pays has always been a low-wage employment, which is too bad. Now, childcare teacher is going to drive to McDonald's, stop off with her breakfast, and see if she can make $15 an hour, $18 an hour. She can get her tuition paid. She can, all benefits. She's probably making, $13 an hour, $14 an hour after being there for 5 years.
Wow.
She might not even have health insurance. So that's the new dynamic.
So how did we get here?
Yeah. Well, it's always been a fragile system in the sense that it's been hard for the parents to afford while there have been very low wages. It's just the dynamic of the ratios and the work. So you either have to make a compromise, either if you pay your staff what they deserve, where's it going to come from? The parents who can't afford it. So there's always been this push and pull between affordability for the families who need it, who are hardworking families, and the hardworking staff. Mm-hmm. And so the compromise has always, unfortunately, been it's hard for both.
It's incredible to me that something so critical can also be so fragile.
My name's Linnea Walker, and I've worked in the field for, 13 years? Yeah, 13 years, yeah.
My name is Gabe Littlefield, and I've been in the childcare. I helped my mom with at-home daycare for a majority of my life, but I've only been doing this professionally for about a year and a half.
My name is Susie, and I've been in the childcare field for 30 years. I feel like we're in the trenches partnering with families that just need to make it. It has to work for them. So we're in partnership with them and their children and the people that think early childhood education and care is valuable.
If they can't afford it, they can't work, they can't pay for their housing, they can't buy groceries. So they need that time away from their children to support their children.
It is concerning because we're seeing a lot of families pull kids from traditional licensed childcare because they're looking for cheaper alternatives. And then we're also seeing a lot of staff shortages around across the board because we're not making a livable wage. And that also comes with trying to increase rates for childcare so that we can make more money, but then people leave or try to seek alternative care because it's cheaper.
So you said two ways to address it. You've got availability and then affordability.
Affordability. So care is not affordable to most families. So you and I both are paying child care, right? And it's a crunch. We're doing it. But if we use the U.S. Department of Health and Human Services definition of affordability, they define this as child care is costing a household no more than 7% of their income. Okay, so if we think about pricing in New Hampshire specifically, Child Care Aware, which is a national network of child care resource and referral agencies. In 2022, in center-based care, families were paying a little over $14,000 a year for toddlers, a little over $15,000 a year for infants. And if they had an infant and a 4-year-old in care, their tuition was about $28,000 a year.
My goodness. Now, if you do the 7% per that number, you would have to be making...
So I've been crunching the numbers. So we're looking at, and for context, the Census Bureau doesn't stratify above $200,000 a year. So it's hard to gauge how many families fall into that income bracket. But if we're looking at meeting that $28,000 a year for a family with 2 kids, their yearly income has to be $400,000 or more.
Oh my gosh.
But as I said, it's hard for us to gauge as a state even what percentage of families it would be affordable to based on this definition.
We're going to take a quick break, but when we come back, we'll have more on the state of childcare in New Hampshire. Don't go anywhere. Today's show was brought to you by Bank of New Hampshire. For 193 years, Bank of New Hampshire has put customers and communities first. With the expertise to help you realize your goals, their technology makes banking easier, and the friendly faces will make you want to visit in person. Want a bank that has your back? Bank of New Hampshire are your people. For more information, visit bnh.bank or call 1-800-832-0912. Member FDIC. Today's show was also brought to you by Burgoo Media, a full-service media company dedicated to helping nonprofits realize impact stories for print, video, social, and legacy media, and more. Both budget-conscious and grant-friendly, Burgoo Media helps your organization celebrate the humans in human services. Learn more at burgoomedia.com. And now, back to the podcast. Because we're both optimists, which we just talked about. Always. My question is always, so what options do we have?
So this has to be a multi-prong approach. That's what our research tells us. There's no single silver bullet that's going to solve this challenge. So New Hampshire has had quite a bit of federal funding come in related to the COVID-19 pandemic and relief dollars. They've also, our legislator put $15 million as a one-time investment into the child care workforce. And it's still a little too early to determine the effect of those things, but we may see a robust enrollment increase in the New Hampshire Child Care Scholarship Program with the recent expanded eligibility. So now families who make below 85% of the state median income will not pay more than 7% of their household income in their cost share for childcare.
And that's per that definition of affordability.
Yes.
So they're saying if we're calling it affordability at 7%, let's make it 7%.
It really makes childcare more affordable to both low and moderate income folks. So if we have a family of 3 in New Hampshire, 85% of the state median income is $89,180 a year. Before the expansion, that family of 3, if they had 2 parents working full-time and an infant in center-based care, they were paying on average $295 a week to put their child in care. With this newly expanded eligibility, this same family is now going to pay $120 a week for their cost share and have about an additional $175 a week that they can use on local economies.
Right.
After many years of really hard work, finally, the legislature just understood that it was necessary for parents to be able to afford it and that there needed to be more funding, more investment to be able to help families afford it. So there's all this is coming out, you know it really well, of all these new policies, and they were passed last year after many years of trying for them. And so it's going to be so much easier for a family to afford it, a middle-income family, not just lower income as well. Both lower income and middle-income families are going to find it much easier to afford childcare because they can get state assistance now.
Right. Now, it sounds like you're talking about New Hampshire's Child Care Scholarship Program, which, of course, just expanded enrollment, 85% SMI, no cost share for some, $5 cost share for others, with a cap at 7% cost share. Why is that a game changer?
It's a game changer because many lower middle class families didn't qualify. It was the cap. So they had to pay the full price, which, of course, is very hard. But now what you said was 85% SMI. That stands for state median income. Here in New Hampshire, that means a family of three, could be a mom and a dad and a baby, could be a dad and a preschooler and a toddler. Family of three, the income cap used to be $55,000 a year. They still might pay 28% of their gross family income on childcare with assistance. Now it's 85%. That same family of three can earn up to $89,000. We're really going to capture more of the families who can't afford childcare, and they're not going to have to pay more than 7% of their income. So what that means is right now, a family with making $65,000 is now going to qualify. They didn't used to. That same family of three, they are going to, instead of paying they got two kids, $28,000 a year. They're probably going to only out of pocket about $5,000. What a difference for them.
That's huge.
Yeah. And, so the public schools, there was a wonderful editor of the Concord Monitor many years back, and he just started his article by saying, imagine what the public schools would look like if only the parents who used it paid for it. So we do need to increase these other types of investments so that it's not just up to the parents, the hardworking families, to cover the cost.
Which, people are going to be excited about because they can apply for these childcare scholarships that they probably didn't get approved for before.
The good thing, I think, too, is everybody aspires for the same thing.
Yeah.
Parents to providers to the bureaus that regulate and also support this field.
Jessie Davis, Bureau of Child Development and Head Start Collaboration.
How does the Bureau view its role in family success?
Yeah, so we are in the middle of our vision and mission planning and trying to look at, from a really high level, what is it that we're trying to achieve? And what we're really trying to achieve is families having choice and options in terms of where their children are throughout the day and what would really meet the unique needs of their family. That's really what we're trying to accomplish, is looking at all the types of programs that families need and identifying where they're needed and trying to support those communities and meeting that family's need.
What does commitment look like in terms of providing, from a state agency's lens, services?
Listening, understanding what the needs are, and trying to identify solutions, partnering with other stakeholders and communities to solve this problem. I don't think that the Bureau can do it individually. I think it's going to take a village. It always takes a village to raise a child. And I think it's the same with childcare. Once we can get all the players working together in these communities, then we can have programs and services that truly meet the needs of the children and families.
Why is choice an important element for families?
Because one size doesn't ever fit all, and it really depends on the background and circumstances of each one of these families. Not every family is going to want their child in a center-based care, and not every child should be in a large center. Some children really do thrive in quiet and calm settings. Some families may want their child to be in a small family home setting, and another family may really value Montessori and autonomy, and another family may want to have more of a nature focus or a STEM focus. And some children may need and benefit from social and emotional supports that may not be easily attainable in a large setting.
Now, when you mentioned listening to create programming that meets the needs of the families means you need to know this experience inside and out. Tell me how you, as the new bureau chief, can bring your background, your knowledge set into this.
I am like a product of all of these systems, every single one of them. And so I understand them very, very intimately. Like when I was a young single mom, I was on subsidy and I was a relative provider, and I did move up through all the professional development systems, and I am a Head Start parent, and I was a Head Start teacher. And
so you know it then from the inside.
And I think that's what makes me good at my job.
This has to do with Granite State's success in general.
Yeah, so this is when we're working, I mean, we support our families, but we're also supporting our state economy. And then in terms of the child development perspective, there are both short and long-term effects of investing in early childhood care and education. This includes the short term, we're looking at things like school readiness. So they're ready for math, they're ready for those pre-reading cognitive skills. Also their socio-emotional interactions, so they know how to be have healthy relationships with other friends and how to participate in a classroom and regulate their emotions. And this also can come down to finances as well for the state. So there are also long-term implications from putting investment in early childhood. So if we're looking at, there's a report from the Tax Policy Center in 2023, and they estimated that for every dollar invested in state and district pre-K for 3 and 4-year-olds, it was a $4.20 return on investment. And this was related to some of those school readiness things, but also long-term things. Like these kids are more likely to finish high school, they're more likely to make more money, they're less likely to get involved with the criminal justice system, and they're less likely to need to use benefits. So it's a really big investment for their development as well.
What is your hope for parents out there with young children?
I hope they can be connected to their children's education.
I just hope that they can just grow and learn to love learning.
Our hope is that they keep their children in their routine, because I feel like we are the safest place that those kids could be.
I feel like the people at his school love him just as much as I do. They see who he is as an individual, so I feel so grateful. His interpersonal skills have really grown, and he's just learning so much about the world around him.
She's saying more words and she's being more friendly. I think that she's already used to a routine, oh, hey, look at my friends. I see her growing. It's kind of strange as a parent to know that you're not the be all end all of his development, but you know that that's probably definitely wouldn't be healthy for me, and then it probably wouldn't be healthy for him either. So it's better to have the village, right, of people who care about him and raising him and getting all those different kinds of experiences rather than just me.
That's what I really hope for, is that these parents get the support that they need in order to be able to financially thrive in the state and stay here in the state and help us progress.
For more information about New Hampshire's Child Care Scholarship Program, expanded enrollment, and eligibility requirements, visit nh-connections.org and look for the Families tab. This podcast was brought to you by Nixon Peabody, who delivers exceptional legal services for clients in the community by combining high performance, an entrepreneurial spirit, deep engagement, and an unwavering commitment to a culture of collaboration, diversity, and humanity. Nixon Peabody works with universities, hospitals, and nonprofits of every size to maximize impact. For more information, visit nixonpeabody.com. Many thanks to the Samuel P. Hunt Foundation for sponsoring this podcast. Established in 1951, Samuel P. Hunt Foundation is a Manchester-based, independent nonprofit that provides grants primarily for the arts, children and youth services, faith-based organizations, educational institutions, healthcare, and human services. New Hampshire Family Now is listed on Apple Podcasts, Spotify, Google Podcasts, Amazon Music, Stitcher, iHeartRadio, and more. Listen wherever you get your podcasts or ask your smart speaker to play New Hampshire Family Now.